Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
One of the billed benefits of Brexit is that we'll be free to strike our own trade deals with other countries, not least the US. But trade deals involve a lot of give and take. And the early signs are that one of the areas of the US wants us to give way on is pharmaceuticals. Politicians in the UK are worried about this, not least Andrew Lansley, the former Health Secretary, who expressed his concerns in the Lords today. But how much of an impact would it really have? Well, Newsnight has spoken to experts who are concerned that if the US gets its way on a trade deal, it could lead to the NHS's branded pharmaceutical bill being more than doubling. Deborah Cohen reports.
Around the globe, the pharmaceutical business might be about to get a whole lot more transparent. And who would argue that isn't a good thing? Well, that depends on what you think it means and in whose interests it's working. Battling with the spiralling cost of medicines is a preoccupation of governments around the world. Newsnight has reported recently on several cases of the NHS facing prohibitive costs. Opaqueness of the pharmaceutical market means it's very hard for countries to know if they've got a good deal compared to another. What most buyers need is to see the bigger picture.
Medicines prices can vary a great deal between countries. Sometimes prices are much higher in wealthier countries and much lower in poorer countries. There can be price differentials of over 100 or even 200-fold for the exact same medicine. But there is no systematic worldwide approach to pricing medicines, so sometimes we see the opposite actually, where poorer countries will end up paying more than richer countries. When governments or health insurance companies, for example, don't have much information about how prices are set, what other countries are paying, or what it costs to develop or manufacture a medicine, they are in an even weaker negotiating position. And so we have a situation where the power imbalance is already significant, and it's just made worse by the increasing confidentiality and secrecy that we see in pharmaceutical markets.
This power imbalance has had the World Health Organization concerned. At its recent annual meeting, the majority of its health and foreign ministries agreed transparency of drug pricing was the way ahead.
The resolution was quite controversial. I would say it was probably the single most important and controversial issue that was discussed at the World Health Assembly this year. It calls for much more transparency in pharmaceutical markets, that the public should know, for example, what are the prices being paid, how long can we expect a monopoly to last, what does it cost to develop a new drug.
But the issue of transparency can cut both ways. President Trump wants to use it to get others to pay more for American drugs.
It's unacceptable that Americans pay vastly more than people in other countries. I am asking Congress to pass legislation that finally takes on the problem of global freeloading and delivers fairness and price transparency for American patients.
So with the UK hoping for a trade deal with the US, could our drug prices actually go up? It's easy for politicians to say the NHS is not on the table in a negotiation, but listen to this from Prime Ministerial hopeful Jeremy Hunt.
Now, that's not to say that, pharmaceutical products, drugs, those kinds of things which are freely traded between countries couldn't be discussed.
A trade deal is a big, influential lever for the US, one it's not afraid to pull.
I've already met with Ambassador Lighthizer, the U.S. trade representative, and he's working on strategies on how we can take this to our trading partners who ought to be paying more and use the full weight of the U.S. government's trading power to try to get them to pay more.
The US has published a document setting out its objectives in a US-UK trade deal. It's not a big document, but it does contain a brief section about the pharmaceutical industry. It seeks standards to ensure that government regulatory reimbursement regimes are transparent, provide procedural fairness, are non-discriminatory, and provide full market access for US products. What might that mean? Well, seeking to dismantle schemes and bodies, including NICE, that have helped to keep drug prices down in the UK for decades. Deborah Gleeson, an academic in Australia, has studied how the US uses trade deals to influence how much governments pay for their drugs, citing deals with Australia and South Korea.
In the Australia-US Free Trade Agreement, the US really targeted Australia's pharmaceutical benefit scheme, which subsidises medicines for Australians in the same way that the NHS does in the UK. The UK will need to be really careful in negotiating with the US, because although Australia successfully resisted a lot of what the US was trying to do in the Australia-US Free Trade Deal, Korea accepted provisions that could prevent the government from getting value for money for pharmaceuticals, and a lot more onerous changes to the decision-making processes around pharmaceuticals.
The European research group Steve Baker has been optimistic about UK drug prices following a deal.
If the NHS can buy less expensive drugs through a trade deal from the USA, then that's a good thing.
On the contrary, some fear that if the US managed to neuter a body like NICE, the UK could end up paying higher prices, more like those seen in America. Dr. Andrew Hill from Liverpool University has done an analysis, which we've had checked by a health economist.
When we compared the US and UK drug prices, we had list prices available in the UK and we had list prices available in the United States. Now, there are discounts on both of those that we can't account for. But we also looked on how much the UK spends overall per person on drugs versus the United States. And when we looked at those two different analyses, we got the same answer, that the prices in the United States are between 2 and 3 times higher than the United Kingdom. And that's been seen by other people doing the same analysis.
Many drug companies do offer discounts and rebates to the big purchasers like the NHS. Such discounts are confidential though, so ultimately we don't know what is actually being paid per drug, hence the global appetite for more transparency. One available data set is from the OECD, that's the Global Economic Organisation with an eye on world trade data. Dr. Hill's team used its figures to estimate that the US spends 2.7 times more per person on branded drugs than the UK. NHS England's current spend on branded drugs is £13.1 billion per year. If it was multiplied by that 2.7, NHS England would be looking at additional spending of £22.3 billion a year. That's £428 million a week, and Dr. Hill's team regard that as a fairly conservative estimate.
The types of transparency that are promoted by trade agreements are transparency in terms of government decision making and access to government decision making processes by industry. That's the type of transparency that helps the pharmaceutical industry. But what we really need to help countries to actually be able to negotiate better prices for medicines is transparency on the industry side.
Some will say this is all crystal ball gazing, and when it comes to it, the UK will strike a hard bargain. But so will the United States. Could the UK end up paying much more for its drugs? It's a cautionary tale, but when it comes to any claim of transparency, UK negotiators should see right through it, right?
We asked the Department for Health and Social Care for their response to this story, and they gave us this statement. The government is committed to ensuring that patients can access the best medications at prices that are affordable to the NHS. It's also important to recognise that other countries have very different health systems and clinical priorities, so it's difficult to make comparisons.